Illinois is set to receive nearly $200 million from the Federal Rural Health Transformation Program. Hospitals and rural health advocacy groups are now taking a close look at what this funding can mean for their communities. News 3's Waylon Walls-Parker spoke with the Deaconess Hospital for a closer look.
Deaconess Illinois Medical Center is taking a closer look at what could come next for them after the Trump administration announces new funding for rural health care.
Illinois hospitals will receive more than $193 million this year through the Rural Health Transformation Program, money that Deaconess Illinois President William Davis says could help address some of the biggest gaps in care across rural communities.
Very optimistic and excited that these dollars have been allocated to help rural America and rural health care.
According to the Department of Healthcare and Family Services, about 2 million people live in rural Illinois communities. The funding comes as rural hospitals face growing pressure, including declining Medicaid enrollment and staffing shortages. Davis says the money won't go directly to patients, but it could help expand women's health care and virtual care.
And how can we expand telehealth services or virtual care services? How can we get services out to the people in the communities in these rural parts that don't have it?
Illinois applied for $200 million per year over 5 years, with the Illinois Department of Healthcare and Family Services overseeing distribution pending federal compliance. But experts advocating for rural health say there are still some unknowns with the new funding.
Right now, we're focused on what we can do with this initial amount of money, but then what happens next?
Charles James with the Illinois Rural Health Association says the new funding is temporary and warns it won't fully make up for the expected Medicaid cuts.
So our concern is, while the money is welcome, that it doesn't allow us to address the proverbial elephant in the room, and that's the loss of those Medicaid dollars.
But for now, for Deaconess and other rural hospitals, the focus is on using that funding wisely and making sure it reaches the communities that need it most. In Williamson County, Waylon Walls-Parker, News 3.